Good morning. My name is Hossein, and I'm MPH coordinator. Actually, I'm Postgrad coordinator. I'm a medical doctor, and I have PhD in health economics, economic evaluation of healthcare interventions. And as you expect, one of the topics within MPH is economic evidence to inform funding decisions. So the aim of this session is just to provide you with some information regarding postgrad public health teaching programs at Flinders. Can you hear me? Is that okay? At Flinders Uni. And probably my presentation takes 40 minutes or half an hour. And then if you have any questions about your program of study, I'm happy to answer. Or I can, if you need more details about specific topic, I can refer you to our topic coordinators. Is that clear? Okay. So let's start with
Hi, I'd like to take this opportunity to welcome you to Flinders University. Every year it's terrific to see new faces on campus and to know that so many people have chosen to study here at Flinders. I love walking through the hub, feeling that incredible buzz and seeing students just like you, talking to new friends, sharing ideas, helping each other out. These are just some of the things that make Flinders such a wonderful place to study, as I'm sure you'll discover once you find your feet. Your first few days may seem a bit of a blur. We've all been there. Starting university is a big step, and it takes time to learn all the ins and outs. But don't worry, plenty of support's available to help make your transition to life at Flinders as easy as possible. Flinders staff and student ambassadors can help you find your way. And I know from experience that your fellow students are kind, inclusive, and always ready to help. So where do you begin? Well, Flinders' website's a great starting point. You'll find campus maps and plenty of information about university life. Our Ask Flinders Facebook page will keep you up to date on university events and Flinders news. Flinders also has a busy social scene, and Flinders University Student Association, FUSA, can help you find social clubs and many other activities. As well as online support, we also provide support in person at our campus locations at Sturt, Tonsley, Victoria Square, regional South Australia, and across the Northern Territory. Here at Bedford Park, the Flinders Connect team in the hub can answer questions about enrolments and course information. The Student Learning Centre within Flinders Library is also a great resource for any academic help that you might need. Our confidential and professional health, counselling and disability services are available to all students. And Flinders Oasis drop-in centre is a warm and inviting space for people from all backgrounds to socialise. Oh, and of course, Bedford Park has plenty of food outlets, although I'm sure you've discovered those for yourself already. I'm confident that you're going to love being a student here at Flinders University, and I hope you're going to have the time of your life.
Okay. Do you know who he was? Mm-hmm. Okay. So he is our Vice Chancellor. All right, so before starting, I would like to acknowledge the traditional owners of the lands we are on today and pay my respect to elders past, present, and emerging. So I think I introduced myself. Do you have any question before I officially start my presentation? Any point, any concern, because I don't want to be a formal presentation, so I really like more interactive presentation. Any question, no? Okay. So please interrupt me whenever you think you need more information. So I start with this question because then I will talk about what we can offer in terms of public health at Flinders, and then you can see whether or not your expectation is in line with what we offer. So what's your key reason to choose public health at Flinders? Doesn't matter, it's MPH or graduate certificate. Is there any particular reason that you said, that's the reason that I'm choosing public health at Flinders? Yes?
Public health is a big issue at the moment with COVID and everything, so that's raised everyone's awareness. I think it's an important subject to look more closely at and learn something about.
Yep. So let me just... Yeah. Can I ask you to use this from now on? Yeah, that's a really good point. So your point is about the significance of the topic itself, given all the problems that we had or situation that we had over the past year, which actually answers the first part of my question, why public health? But I think my question has two components. Why public health at Flinders? Do you want to continue for the second?
I chose Flinders because it's closest to home.
That's right. Yeah, that is actually really good reasoning. Location is one of the reasons, and we find through survey that usually people do here at Flinders, location is one of the key factors. Yep. Can I just ask, because this is being recorded, and no, that would be fine.
I think it's important to look at health beyond biology. So I want to go into medical field, but I think it's important to see how stuff happens in a population basis rather than individual.
Yes.
Why at Flinders? I've got friends who work in public health field, and they say Flinders is very good for getting employed, basically.
Oh, okay, that's good. Mm-hmm. Thank you. Yeah, okay, so the second potential... Oh, sorry, I missed you. So let me just explain, and then... so the second reason is... so one was location, that's fine. Second reason is talking about getting a job, which is based on some figures probably, that if we look at the figures, I mean the employment rate after graduation, across, especially across 3 universities in SA, yes, we are in a good or healthy figure, which is really important. And then I can explain why this factor is really important and how the content of our postgrad public health can help you to find a job quicker and more efficient. All right, so.
Yeah, hi.
Can you introduce yourself?
Yeah, sure. My name is Neven. I finished Bachelor of Health Sciences just last year, and I decided to continue doing it on Flinders University, primarily because of the atmosphere that uni provides. It is not the best location for me because I live up north, but the atmosphere of the university, layout of the university gives a proper university lifestyle. And another reason why I choose the public health at Flinders University is due to its relationship directly to the hospital. But first part of the question why I chose public health is because I'm interested in evaluation of the health system performance and epidemiological context in the sense of, okay, now is COVID most important kind of thing that we discuss, but prior COVID was something else, and tomorrow will be something else. So the public health matters keep changing over the time, and we just constantly are active. So therefore, I feel that the system and our performances need to follow that as well. And I'm just interested that system in place are actually performing to the best possible kind of limits that we can operate at. but also what are I'm interested in the challenges that it also open up to the public. Yes. So how the public can actually raise the awareness that something is not operating at a desirable level, for example.
Yeah, that's great. That was a brief lecture, I think, about the public health, but which was good. Yeah, exactly. I agree. And you mentioned the evaluation is one of your probably key area of interest, and that's a really good point, because evaluation of healthcare interventions, doesn't matter economic evaluation or evaluation of acceptability or evaluation of just safety, evaluation of effectiveness, which is basically our epi topic, or our biostat topic, which can be used, the principle that you learn can be used to generate new evidence or interpret new evidence in a good way. Yeah, that's really good rationale behind the choice of public health, especially at Flinders.
Can I ask a question?
Sure.
Do you think from that maybe in the future we'll be able to predict as well?
Which problems?
Or he's talking about evaluation.
Mm-hmm.
But from evaluation, can we also go to predictors and trying to assess what's going to happen in the future?
Yeah, definitely. I think that's a
Go from reactive to proactive.
Exactly.
Yes, definitely. I think that's a really good point. Instead of just sitting here and see what happens, we can actively be more engaged in, first of all, generating effective data. What sort of data we need to predict, because prediction should be based on valid data. Secondly, based on how you develop a model to predict, for example, epidemiological model, and then you can input lots of data and then predict what will happen or potentially will happen over the next few years. So there are lots of potential for public health, as you said. It's not, and I fully agree with you, instead of just, this is intervention and then we implement, we evaluate, we should take more active approach towards identification of the problem and finding the problem in advance and designing a solution. So that's a whole pathway of public health in general. I'm not saying we at Flinders offer every component of this big pathway of public health, which starts with identification of problem, designing a solution, implementing the solution, evaluation of the solution, redesigning. Are you following me in terms of the big pathway in public health? I'm not saying we are offering everything, but I think that's our idea. At least when you look at our topics or the flow of topics and the content, we try to have this big picture for students. And when you finish especially when you finish your Master of Public Health, you should again ask this question: have you learned about this big pathway? How to critically review the existing policy? How to design a new intervention? How to evaluate the new intervention? How to translate new evidence into practice or policy? How to re-evaluate and revise your intervention based on the needs or changing situation. So everything is about this big picture in public health. Does it make sense? Okay. Any other person who is interested to share her or his reasoning for the choice of public health at Flinders? Because these are really good reasoning. And it also helps me as a course coordinator. Sorry, we are missing you. I'm just standing here. Okay, yeah. Let me just, yeah. Thank you. Can you introduce yourself? Thank you.
So I'm Amanda, and I've been a research associate here at the Flinders University for the last 10 years.
Yeah.
And I'm interested in developing my theoretical knowledge and underpinnings of public health.
Yeah.
So I have a Master of Social Work background, not a public health background. So that was a really important component for me in terms of developing a career path.
Yep.
And why Flinders University? I had looked at the London School of Hygiene and Tropical Medicine, and I had started their course several years ago, and it was terrible. It was 100% computer-based and 100% exam-based, and that doesn't suit my learning style. So that was really important to me, to find a course that has some flexibility in how it assesses and what sort of interaction is, because that's really important to me as a learner, and particularly as an adult learner. And also I looked at Monash University. While they have a great program, it's a long way away, and I like the interaction, and I like the connection that Flinders has, and that I have to Flinders University as well.
Definitely, yeah. Thanks, Amanda, thank you. Thank you. You know, all good points. And good news or bad news, we don't have any exam for our topics. Personally, I think it's a bad news, but anyway. Yeah, that's right. So I agree with that. But you know, yeah, my brain is more quantitative and exam-based. So, but I understand some people don't like, you know, this sort of assessment, and definitely in terms of learning, some people gain more when it's just, you know, for example, discussion-based papers and this sort of thing. Definitely, I understand. I don't agree, but I understand. No, I'm just kidding. All right. Any other? Please, one more. Just one more. Sorry, just introduce yourself. Thank you very much.
I've got nothing really to add, but just so to let you know that I like the topics, and also I was an undergrad many moons ago. I did nursing here, so
okay.
yeah, so I've moved back to the country and decided on a different career path. So
okay.
yeah.
So when you say you like topics, what was the?
I could have chosen every single one. I think they all interested me.
Oh, okay. That's good.
So.
Yeah. That's really good. Okay, yeah. So I understand you are all commencing students, but if you look at last year structure, our MPH structure, so that there are some changes in terms of the topics, the structure of MPH and graduate certificate, as well as option topics. So that was my aim or my plan to make it broader, especially in terms of elective, because core topics are compulsory. We can't do anything. But if we just introduce more elective topics, because different people have different interests, especially when it comes to elective and option topics, especially at postgraduate level. So they should have this opportunity to have, you know, this sort of choice from public health nutrition to environmental health to aged care, primary care, I don't know, leadership, and this sort of, and even economic evaluation for advanced students as an option topic. So I think that's really important. So I talk about this. So any other question, or I can continue? Okay. I don't know why it doesn't work. Okay. So I think we had a really good, very useful discussion about the choice of public health at Flinders. So let me just briefly talk about the aim of our postgrad public health teaching programs at Flinders. So I think the aim is to improve your knowledge, and back to one of the students' point, which was about we don't know what happens next year or the other years in the future. So I think it's important to learn about the principles of public health, which can be applied to any problem or designing any solution or implementation of any solution or evaluation of any solution. So that's why we start with improve your knowledge and especially practical skills. That's our focus at Flinders for public health programs. So we really care about practical skills, and believe me or not, we had, especially the past year, we had lots of meetings with topic coordinators, how we can improve, and still we are far from ideal, I have to say. based on my criteria. But I think the direction is right. So we are moving towards having lots of practical sessions. This practical, in terms of quantitative topics, would be even working with numbers for those who are interested in quantitative side of our program, or in terms of qualitative component of our program. We have lots of qualitative topics. I talk a little bit about this. Lots of tutorial, lots of group discussions, and we really believe that this sort of group discussion and interactive discussion can improve your knowledge. And to be honest, I learn lots of things from student group discussion. And it happened to, even for my topic, which looks like a kind of more quantitative, is economic evaluation. But I have a couple of, mainly quantitative, working with numbers, but I learned lots of things from students, and that's really good. I mean, when it comes to interactive discussion, I think that's really, really important to improve our practical skills. So I said for practice of public health can be applied to any types of problem. But what's the aim? So you improve your knowledge and practical skills for practice of public health, but what's the ultimate aim? I think the ultimate aim in public health, and it's very simple, there are lots of aims that we follow in public health, but is to improve population health. And I was struggling to use improve or maximize. What do you think? Because when you say the aim is to maximize population health, and then I said, while understanding the principles of equity, is there any trade-off between principles of equity and maximizing population health? Because when I was preparing this slide, I was thinking about the trade-off, probably based on my background, economic evaluation background. But what do you think? Do you think there is a trade-off between applying the principles of public health in order to improve or maximize population health and equity in healthcare? Is there any trade-off? What do you think?
So,
yeah, just introduce yourself, that would be great.
I'm Douglas. I think the trade-off would be to maximise, you have to have the full potential, not potential, but the leadership of government on board, which you will not get because that means spending money, which they will not do. And
yeah, so, yeah. So you okay? So you are thinking investing money from, for example, government, but it doesn't lead to improving population health or improving equity. Which one?
Equity, I think.
Equity. Okay.
Yep.
Yeah. Okay. That's right. Yep. Yeah. Sure. Thank you.
I just think to expand on that, just because even if you provide all the money in the world type of thing, all the access in the world, doesn't mean it's going to get to everyone the same. Yes. That's the trade-off in equity, is that it's not going to get everywhere the same amount.
So can you give me an example? Sorry, because you are very active, so I'm asking questions.
Okay, so just a really broad example, rural to city. Just even if you give them the same hospital access, not access, the same level of quality of hospitals type of thing. Yeah. The emergency centres are all perfect, and there's going to be no running out of supplies. Doesn't mean people can get to those hospitals in rural areas. So that's where the equity is reduced.
Exactly. Yeah. Thank you very much. Yeah. That's true. So there are lots of examples about trade-off between maximization of population health and equity. And this all about the concept of opportunity cost. Are you familiar with the concept of opportunity cost? It's everything about opportunity cost, because we have limited resources. Whatever you do, you can't meet, I mean, anything. You think about, I don't know, hospital services, heart surgery, whatever, you know. But still we have limited resources. So then you have to decide, a policymaker based on some data or information, they should decide. So back to your example, whether or not I have to build a new hospital in rural area, that would be really good because it reduces equity, as you mentioned. But how about the maximization of population health? Because the level of resources that you are spending to build a hospital, I'm not judging, I'm just describing the issue, the big issue. The level of resources that you are spending in terms of staff, money, whatever, to build a new hospital, that means less resources for other purposes because we have a limited resources. So that means if you are thinking about maximization of population health, this decision, policy decision, is not good because it doesn't necessarily lead to maximization of population health because you are putting lots of resources for a small group of people. But on the other hand, if you think about equity, principles of equity, this improves the equity. So sometimes, I think my point was that sometimes you have, not sometimes, in many, many cases, you have this trade-off between equity and improving population health. And I think our postgrad teaching programs, based on the notion that we have the concept and lots of discussion that we had with our topic coordinator, try to reflect this. I think it's really, really important for public health practitioners to understand the difference between principles of equity and maximization of population health. Any question? Is that useful? Because I'm trying to just provide you with some big picture of what you learn and the key concepts. So please think about these sort of principles and apply this thought or principles to any topics that you learn, because somehow all topics within our public health teaching program are dealing with this trade-off. Okay, so in terms of the key area, I think, as I mentioned, how to identify a health problem and key issues influencing this problem, especially the focus of our MPH and graduate certificate or postgrad public health teaching program at Flinders. One of the key area of focus is social determinant of health. As you can see, is just, for example, Adelaide Uni doesn't provide this, probably because we have lots of internationally recognized researcher within social determinant of health. And although it's not my area of expertise, but I think it's really, really important to again, to understand or to define public health problem within this context and thinking about social determinant of health. Are you familiar with social determinant of health? Okay. So what do you think about social determinant of health? Any idea how to assess social determinant of health within the public health context? Because this is one of your core topics, doesn't matter graduate certificate or master of public health, doesn't matter advanced or non-advanced. This is one of the core topics. So I think it's really important to get some idea before the topic starts. It starts next week, am I right? Next week, yeah. And it's a very interesting topic, I have to say. As I said, it's not my area of expertise, but I really liked it when I looked at some contents, and I have to say I don't understand some part of it, but I think that's really, really important. And again, based on the feedback that we receive from students, almost all the students like this topic and the interaction involved in this topic. So that's the first one, how to identify. And second one is how to develop a solution. Again, some of our topics will focus on how to develop a solution. And in order to develop a solution, we need to be able to critically analyze the existing evidence or policies. That one part of generation of a new solution, because you have to think about the problems associated with the current or existing evidence or existing policy. So again, there are lots of practices within our topics in terms of critical, depending on the topic. For example, for my topic, I have one lecture and one assignment about critical analysis of economic evaluation. Other topics have, for example, critical analysis of policy decisions or public health policies. And we have this year, we have one of, I think we are lucky because we have one of the internationally recognized public health practitioner who just retired, and he was sitting on WHO, World Health Organization committees in terms of identification and developing a solution for flu problem a few years ago. So he can provide you with some insight, which is really good. And I think it's within the leadership or critical perspective topic. He will talk about, I think in 1 or 2 lectures, he will just share with you his experience in terms of how this big and global problem was dealt with within WHO committees and designing a solution. So the principles of designing a solution. Although again, it's a flu, but the principles that he talks about definitely can be applied to different situations. And then I said the principles of research method to generate new evidence. Now you know you need to generate new evidence. What are the topics to help you to generate new evidence? So as I said, we have a number of qualitative and quantitative. When I say quantitative, of course, we have EPI, we have biostat at different level in terms of introductory level, which is basically the core topics. And for those who are interested, again, we have advanced biostat, advanced EPI, and also we have economic evaluation as part of the quantitative approaches in order to generate new evidence. Leadership in public health, that's another key area that we try to cover. Again, the principles, how to manage projects, how to, briefly probably, how to translate the new evidence generated into practice and policy. So there are some principles involved, and we try to talk about this or cover this issue as well, and the evaluation. So now you can see the bigger picture of the core topics that we created. So evaluation of healthcare interventions, including acceptability, effectiveness, and cost effectiveness. I think that covers the key area of public health. And of course, there are other areas as well, but I think that's a good starting point. And I think if you have this knowledge, and especially, and I have to highlight, practical skills. So we are not really, I mean, when it comes to be employed by a potential employer, I think having practical skills is really, really important. So you have to show your employer that you have these practical skills. And as I said, we have lots of practical sessions to make sure that you get what you want. Also, we have some sort of teams across all topics to improve teamwork and communication skills. So lots of assignment needs some sort of teamwork, and as well as, for example, presentation, which is about communication skills. Again, that helps you, I mean, I think in terms of your future employment, I think these sort of skills are really, really important. Any questions so far? Then back to my point about option topics or elective topics. So I think we are, again, we are offering, compared with last year or 2 years ago, now we are offering a broader range of option topics covering chronic condition, environmental health, health ethics as well. So that was one of my initial thought, that we have lots of good topics across the university which is related to public health. For example, in College of Nursing or even College of Sciences or College of Government. So we have lots of good, so why we are not using this and putting in. So I found a number of really relevant and good topics, and I asked the topic coordinators from different colleges if they are happy. And the reception was really, really good. Some of them actually talked with me about how they include, because that's a big job, but how they can include public health related examples into their topics to make sure that, so I think that would be really, really good. Student-centered learning, I think is a broad concept. So as I said, we strongly encourage active engagement in group discussions and practical skills. Online delivery, I think you are now familiar with all this online delivery. So depending on the situation, and to be honest, I'm not confident at this stage, not me, even I think Vice Chancellor is not confident what happens over the next few months. But the general principle, the plan is to deliver the lecture online, and then depending on the number of students or capacity of rooms to make sure that we are following the social distancing rules, I think I leave it to topic coordinator to decide about practical sessions, tutorial or computer lab or whatever it is, depending on the topic, to decide whether or not they can do it face-to-face. I know, based on, again, feedback that we received last year, lots of students, especially international students, like this face-to-face and losing this sort of, potential for interactive discussion and this sort of thing. But I think that depends on the situation. So today that I'm talking with you, lectures are online, but practicals can be face-to-face depending on the type of topic. Any comment about this? What would you like? Yes?
I've enrolled in an online topic, but I've got no schedule for it. Is that normal? When do we find out? This subject's a medical school subject online.
I don't know about medical school, sorry, but
advanced methods.
Yes, that's MMED. Yeah, I can't comment because that's not my area. But for public health topics, you should all have access to your flow, and the flow should include study guide or topic guide, and topic guide should include all timetabling and everything.
You're saying all lectures will be online. We won't need to attend.
For
At
lectures.
At the moment, I've got a schedule for lectures.
Yeah. Oh, okay. So I misunderstood. Yeah. You because that's based on, I think, the system that we developed. So the system still booked the room for face-to-face. And this is partly because of uncertainty around what will happen. So we booked the rooms even for lectures, but definitely you get instruction from topic coordinators to say that this would be a link or collaborated link for online lecture. So next week or probably by end of this week. So yeah, it is a little bit confusing. I agree with that. But again, as I'm saying, I think the general plan is to deliver all lectures, although in the timetabling you see the date or even I don't know, even the location, venue. But this is not happening. This won't happen, at least for lectures. Yeah, but still we booked the room just in case because one of the topic coordinates, depending on the number of students enrolled, I think it was 10 students enrolled in one of our topics, and the topic coordinator and all the students actually were happy to have this face-to-face. It was easy. So we decided to book rooms, making sure that, because the system is very complex in terms of room booking and this sort of thing. But no, in terms of online delivery, yeah, still lectures will be delivered online. Industry placement. So that's something else that we are working on it, and we hope that we can. So this year, this semester, we have a few. Of course, as a commencing student, you are not eligible, but For those who are at the later stage of their program, we can provide some sort of placement and experience working with SA Health on some data that they have. So for those who are interested, again, that would be a good opportunity to have this working experience along their study. Where we are, I think that's sure.
For those industrial placements, how will we find out about that?
Okay, so industrial placement will be offered within your capstone topic, which is public health practice development. So when it comes to public health practice development, our coordinator provides all the information because that's within this topic. Okay, so this is the list of colleges that we have. And of course, we are in College of Medicine and Public Health, and a range of teaching programs, including chronic condition management, CBT, bio, and public health within our college. So and I'm quite sure you have seen these two links, which, and this is for 2021 course rules, as I said, because we changed a little bit. So the course rules might be different from 2019. So if you talk with one of your friends who enrolled in 2019, and he or she is taking different pathway, that's completely fine because the course rule was different. But I think you need just to stick to 2021 course rules in terms of core topics and option topics. So just briefly about our postgrad teaching programs. So as you know, we have two types of MPH. I think, so how many of you enrolled in MPH? Just, yeah. And advanced or non-advanced? Mix? Yeah. 2 years or 1.5 years, yeah. Okay, yeah, okay. So we have a mix of enrollment, that's fine. But 2 years MPH is 72 units, and 1.5 years is 54 units. And then we also offer some, and I'm quite sure some of you who are enrolled in graduate certificate, a couple of them, yeah, okay. So graduate certificate in public health and graduate certificate in health promotion. And I think everybody knows that. So most topics are 4.5 unit topics, but we do offer some 9-unit topics as well, including our capstone and the evaluation topic, which is 9-unit topic. So again, that's provides some flexibility. As I said, each topic has a study guide or topic guide, and we include all the information there. And this is really important because don't ask me to overload. Yeah, they need my approval, but usually I don't like this sort of request, more than 18 units of a study within one semester. So try to, I mean, whatever is in your mind in terms of study plan, part-time, or when do you want to finish it, make this plan in advance. And for this plan, I'm more than happy to sit with you, I mean, online meeting, whatever it is, if you have any questions or any concern or you need clarifications in some sort of pathway. But please think about this in advance, because I have lots of several examples of different students started in 2017 and then just one topic every year, or that's not useful. You know, believe me or not, is not useful. I can talk about this in more detail if you want. And I think that's a very simple graph. So we have graduate certificate. So credits can be transferred for those who are enrolled in graduate certificate, can be transferred into our MPH, definitely these 18 units. And the structures are in line with each other. So if you complete your graduate certificate, it would be really easy to go through our MPH. Also for those people who are, for different reasons, they can't complete their MPH, then there is an exit award, which is graduate diploma after completing graduate diploma in public health, after completing 36 units. Again, there are some course rule for graduate diploma. Again, if you have you need any information, just let me know and I provide you with, but at this stage, don't think about exit award, all right? Just stick to your plan. I think that's a decision tree for MPH. So we have 54 units versus 72. And for each one, we have coursework and coursework plus research. Are you interested in coursework or coursework and research, or depends on what's your plan for this two pathway within each MPH? Have you thought about it? Sorry? Yours is coursework and research. Okay, so you want to take public health dissertation at the end of the same. Okay, because because the reason that I'm talking about this is, again, think in advance. Yeah, you can't think everything in advance, but in terms of upgrade to PhD, so you need to complete at least 18 units of research. So that's eligibility criteria to upgrade to PhD. And again, we had quite a few students who finished their coursework and then they suddenly thought, oh, okay, PhD is a better option. And then they have to complete graduate diploma in research methods or something like that to be eligible for PhD. So if you really think about the PhD upgrade, then again, you can talk with me as well, and I can provide you with more information in terms of which pathway would be better and more appropriate. Just a structure. So as you can see, for our MPH, we have core topics, and I said major topic, which is public health practice development within the coursework pathway, and public health dissertation within coursework and research pathway. So we have a number of core topics. This is 72, 2 years. Number of core topics, a number of elective topics, and one major topic. The difference is this is 9-unit topic, and this is 18 units of research. And this is the place of industry collaboration and industry placement, as I said before. And you can't, for example, take this topic now. There are some eligibility criteria. You have to, for example, complete 50% of your program of study or even 50% of your core topics in order to be eligible to take this capstone topic. And this is exactly the same structure for 1.5 years, as you can see. So in terms of core topics, we have qualitative research methods. We have intro bio, intro to EPI, and a couple of, as you can see, social determinant of health, and First Nations, which is about Aboriginal health. Yes? Just louder, please, too, because...
Sorry. Is there any way you can combine the research pathway with doing the actual industry placement, or is that too much?
It's too much, because the public health dissertation topic itself is 18 units. So it's a full semester, I mean. So yeah, it would be really, really hard. I won't recommend. Yeah. But again, if you are really interested in, yeah, we have some other options that I can consider. But yeah, generally I don't recommend. Graduate certificate is 18 units, 6 months only, and really is good for to increase the employment opportunities. So coming from some background and then just doing graduate certificate in public health, for especially with the range of topics, elective topics that you have. So again, as I said, flagship topic, social determinant of health, and 4.5 units from this list, plus 9 units. So everything is on website, so that's why I'm just quick. But if you have any question, just let me know. And this is for graduate certificate in health promotion. That's just one example of 1.5 years study plan for MPH, 1.5 years. This is for full-time. And again, I'm happy to, again, if you have different choices or different living arrangement or whatever it is, we can work it out in terms of your study plan tailored to your needs. But as I said, this is just an example. And again, you can find everything here that I just discussed. Oh, let me just talk about career, and then I provide you with some useful link. So potential employers, given my some sort of relationship with SA Health and a couple of other employers, so I'm in touch with them in terms of how we can introduce some of our students based on their expertise or good performance. And definitely Department of Health would be a potential employer. PHN, which is Primary Health Networks, they need lots of skills in terms of evaluation, especially evaluation of intervention or designing new intervention, public health intervention. Cancer Council, Research Institute Center, Diabetes Australia. We had a few people from our university, public health graduate, who was employed in diabetes say. So they, for example, they have lots of projects in terms of screening of diabetes, which is chronic condition management topics that we have, in terms of prevention of diabetes, and in terms of management of diabetes. So that would be a good place. And I mentioned a few potential occupations: public health officer, public health project manager, again, depending on your work experience, previous work experience and skills. People with good knowledge and skills in biostat is highly in demand for especially working with large data. And from next year, we will have which is kind of is related to your study plan as well. We have a big topic about machine learning. It's purely biostat, but it's really in demand. So think about this for those who are interested and comfortable working with data, big data. Yes.
How much say do we get to have in terms of interest areas? So I've got big interest in childhood development and that sort of stuff. So is there much say we can go to what sectors and that sort of stuff, or is it we just put it to one?
For childhood development specifically, do you mean about our topics or employment?
In the employment topic. So when they do the placements type of thing, how much say do we get to have, or is it just you put us into one?
In terms of industry placement?
Yes.
Okay, yeah, sorry. Okay, two options. We provide two options. One option, which is easier for us, if you can find a proper industry placement related to your area of interest, we definitely can help you and support you to get this industry placement, all right? So definitely you have say in choosing your industry placement, definitely. That would be our preferred option, to be honest.
If we find our own.
Yes, that would be our preferred option. But for those who are not or can't find or this sort of, you know what I mean, then we are trying to generate a pool of industry placement and providing this for, if you don't have anything specific in your mind, this is our available, and then you can choose from this pool. But the first option is our preferred option. Okay. Oh, yeah, I don't like to talk about this, but I was asked by all topic coordinators to put this slide in. Personally, I don't like it, especially at postgraduate level, because there is a difference between undergrad and undergrad. I understand, but for postgrad, I'm quite sure you're all familiar with these principles, and I don't need to talk about this. But it's happening every year. It's happening, unfortunately, every year. A few. So please, and you know that we have Turnitin and everything to, it's easy. I mean, it's really easy to detect all these things. I don't know why some students don't think about this. It's very easy to detect. So please visit this website, which provides you with more information about this sort of breaches, just for your information. Thank you. So, because I really don't like to talk about this. It is not appropriate for me to talk about this in this session. Okay, so in Flow, you should have access to this public health course site. Is that correct? And then, yeah, I just gradually provide more information as we go. And you can find some study pathway, examples of study pathways for graduate certificate and MPH. And I, again, strongly encourage you, if you have any question at the course level or any suggestion, any feedback, any comment, there is a discussion forum that you can post it. And that would be, I'm quite sure that would provide lots of discussion from different students. That would be great. I really appreciate it. And a few links, again, because we upload these slides on, I think from my memory, OVIC library or something like that. I will provide you with more information when I'm quite sure about this. But again, these sort of links, and I provided just a brief description of what sort of information you can find. And again, please look at this. And of course, some of you might be interested in different information, but definitely that's the key information that you can find through our programs. And please, because that saves my time, right? To be honest, I'm a busy person. So this is really important. If you have any questions about enrollment, don't ask me. I don't know. To be honest, I don't know. That's not my job to talk about your enrollment, about credit transfer process, because we do have lots of people to do this. So that would be your initial contact for enrollment, credit transfer, leave request. You can't believe that. How many leave requests I'm receiving from students. What should I do with leave requests? That's not my job. So please send all these things to Ask Flinders. And then if you have any question about the content, any question about study plan, any question about structure of our programs, or any concern about specific or particular topic coordinators, topics, definitely that would be me to talk about. All right? And this is my email, my phone number, and everything, and definitely you can find my details elsewhere as well. Okay.